Let's continue talking about symptoms. So far, we have learned how to describe symptoms and injuries. We have learned how to ask about symptoms and injuries, and now we're gonna learn how to give instructions to patients when they have to follow certain procedures. First of all, let's check this recording. In this case, we have some people assessing a patient, okay? So we have the nurse, Mr. Jenkins, and Kyle, and they are talking about a situation that happened last Sunday.
Unit 4, Recording 33.
Hello, Kyle, Mr. Jenkins. Glad you could come to the clinic today. How are things?
Kyle's had a couple of attacks since we saw you last week.
Right. So when was the last one, Kyle?
Sunday.
Sunday, okay. And can you tell me what you were doing when it happened?
Playing football with Dad in the park.
How long did it last? Do you remember?
I dunno. About 10 minutes?
A bit less, I think, nurse. 7 minutes, no more.
What symptoms do you have when you get these attacks?
My chest feels all tight.
Okay. And how did you try to control the attacks?
I used my inhaler. The blue one.
The reliever inhaler. That's good. Your best friend is asthmatic too, isn't he?
His cousin.
Ah, my mistake. What I'd just like to do now, if that's okay, is to check how Kyle is using his inhaler. I want to make sure he knows how to use it properly.
Ah, that sounds like a good idea, doesn't it, Kyle? Just to be on the safe side, eh?
Okay, so as you can check in this recording, now what the nurse will be doing is to explain and to observe what Kyle does with the inhaler. So let's see the instructions that he's receiving in order to use this inhaler.
Unit 4, Recording 34.
First, sit down at a table. Don't lie down. Then lean forward slightly and put your arms on the table. Next, take up to 6 puffs of your inhaler. Call an ambulance after 6 minutes if your symptoms don't improve. Then, continue to take your inhaler every 6 minutes for a maximum of 6 puffs. Finally, repeat these steps if your symptoms begin again.
If you observe here in this image, I have highlighted some information that is important to remember when you are giving instructions. Even in Spanish, when we are giving instructions, normally we will use this structure. So observe, we have verbs like sit, put, call, take, lead, continue, and repeat. Also, we have like a negative instruction or something that shouldn't be done, that is don't lie. So how can we give instructions to our patients when they need to follow certain treatment or when they have to follow certain steps? Well, the grammar that we're going to be covering here is the use of imperatives. But how can we do an imperative in English? This is really easy. So we're going to be using the verb in the simple form and then the instruction. Like check for signs of circulation, apply the pads to the chest. So we're going to use this to tell somebody what to do. What if we want to say something that somebody shouldn't do? Okay, so we're going to use the negative form in the simple present, don't, and then the verb in the simple form, remove. Don't remove worn clothing. So this is really easy. So if you remember how to do it in simple present, you will do this very easy. In addition to this, we can emphasize what is important, and we're going to use this structure, make sure. Make sure the gown is clean. So this is the way that we're going to be giving instructions. We need the verb in simple form, or we need don't with the simple form, and then we have make sure. In any case, we don't have a subject. Have you observed that? We don't need a subject because the instruction is always you. You check for signs of circulation, you apply the pads, you don't remove, so we don't need to give the subject in this case. Observe the example I have here about the Heimlich maneuver. You know this, right? When someone is choking, you can use this maneuver. And observe what I have here. For example, make sure the person is choking. Place yourself slightly behind the standing victim. Make sure the victim knows what you are doing. Place your arms. Make a fist with one of your hands. Grab your fist. Deliver 5 upward squeeze. Don't squeeze too hard. Make each squeeze thrust strong enough. Make the diaphragm move air out. Keep a firm grip. Repeat the Heimlich maneuver until the foreign body is expelled. So this is the way in which we can give instructions to our patients. So are you ready to practice?